be presenting assessment of pain in pediatric populations.
Okay, go ahead.
So definition of pain is, it is an unpleasant sense, emotional experience associated with actual or potential damage are described in terms of such damage. So pain has a component of both emotional, physical and behavioral responses. So the assessment of pain is based on the physical behavioral responses of the child. And it is based on either self-report or observation of behavior. Usually in children, the pain perception and nociception are fully developed, but the inhibitory pathways remain underdeveloped. So they have the widened receptive field and they have the low sensory discrimination and reduced inhibition of pain. So assessment of pain in pediatric population is very important, but therefore the assessment in pediatric population is very difficult since the pediatric patient will not be able to express or communicate, and they will show a most common non-specific symptom like crying. And the assessment of pain is divided into self-report or observational behavior, and it is based on the age of the child. For neonates and infants, it is premature infant pain profile, which is an observational behavioral tool. We have to observe some signs from the child and we have to grade the pain. It relies on 7 indicators such as heart rate, oxygen saturation, facial expression, eye squeeze, brow bulge, nasolabial furrowing, and crying. And one more scale for neonates and infant is CRIES, which is expanded as C for crying, R for requirement of oxygen, I for increased vital signs, E for expression, S for sleeplessness. The increased vital signs includes increase in the heart rate, increase in the BP, increase in the mean arterial pressure, and increase in the respiratory response, which is tachypnea. And the other scale is FLAC scale, which has the expansion of F for face. We have to look the expression of the face, and the legs, L for legs. We have to look for the posture and withdrawing of the legs. A for activity. We have to look for the activity of the child, whether it is active or it is arching, rigid, it is tensed. C for cry, whether the baby is crying or whether it is C for consolable, whether the baby is consolable or not consolable. So it is the abbreviation FLACC, FLAC, face, legs, activity, cry, and consolability. For toddler age group, the FLAC scale is used, and the other scale is comfort behavioral scale, which has 8 indicators. Each is graded between 1 to 5 and a total score of 40. They include mean arterial pressure, respiratory response, heart rate, muscle tone, activity, facial expression, alert, calm, or agitation. If the score is less than 26, then the treatment is adequate. If the score is more than 27, then the baby needs some pharmacological therapy. And children between 3 to 8 years, it has a poker chip scale. The scale has a 4 red poker chip, and the child, it is a self-report measure so that the child will able to express the pain what they experience. So we have a 4 piece of red poker chip, and we have to inform the child that it varies from no pain to the worst pain. If they choose a 1 poker chip, it is no pain, and if it is the 4, and it is the worst pain. Wong-Becker faces scale, which has the faces showing from a very happy to a crying face. It is graded from 0 to 10, 0, 2, 4, 6, 8, and 10. So it has 6 indicators, 6 faces, and it also has 6 wordings. So we have to ask the child to choose the face which expresses the pain what they experience. And faces pain scale is also a self-report measure. Same thing, the child has to select the picture of the face what they experience. It is also scored as 0, 2, 4, 6, 8, 10. And CHIOP scale, which has the expansion of Children's Hospital of Eastern Ontario Pain Scale. It is an observational behavioral measure. It has 6 behaviors: cry, facial expression, and the child's verbal, torso, touch, and legs. It is very difficult and lengthy and cumbersome. An Oucher scale, which is a self-report measure, it has 2 scales. One side it has the numerical values between 0 to 100 and other side it has the photographers. So if the child is able to communicate and value the numericals, they can select it from 0 to 100 on the left side, or otherwise they can select the photographic face which expresses their pain. And the children more than 8 years who can understand, cooperate, and who can express and who knows the value of numericals, they can have visual analog scale. It is a self-report scale and it has very high sensitivity. There is a horizontal line from left to right. It shows from no pain to worst pain. And we have to ask the child to intersect the line, how much pain they have. And the numerical rating scale, we have to ask the child whether how much pain the child has out of 10. So they have to select a number from 0 to 10 and the amount of pain they have. These are self-reporting scales for children who are more than 8 years. That's all.
Good. So what you have to understand is in pediatric, there are two categories. One, the children who are grown enough, who can have a cognition and report their pain. The other group is infants who cannot talk, who cannot comprehend, who cannot report. So there we have to observe the behavior of the patient and then decide whether the child is, for example, after a hernia surgery, you are given a very nice caudal block. We have done the surgery under sedation. The child will be very comfortable, sleeping nicely after the surgery in the mother's. And once you give it to the mother is the best sedation for the kids, especially the infants. So once they feel the warmth of the mother, they will quietly sleep. On the contrary, in an inadequate analgesia, both during intraoperative and postoperative phase, they will be yelling. You would have seen on children who cry vigorously, and the reason for crying is not always pain. It can be hunger, it can be separation in older children, or it can be the pain also. So the other reasons also you have to rule out. So that is where self-reporting is the best method of assessing the pain, which is possible only in children more than 3 or 4 years old. Up to 16 or 18, we call them all under the pediatric category. In the Western world, up to 16, they are all called pediatric. So older children will be able to report the pain. So that is the reason why pediatric assessment is very difficult, and that is why so many scales have been there. I think you have also prepared this on the anesthesia tutorial of the week article, which is available in the WFSA Stadium. So we'll just see the whole thing. So pediatric pain assessment, formal means are self-report and observational. These are the two categories. So the first thing, self-report is always the best, because the children can directly communicate and tell you, and the visual analog scale is supposed to be the easiest method of assessing the acute pain score. Mostly it is used only for acute pain and not chronic pain. The patient draws a line that intersects the indicate the intensity is for ages 3 to adult patients. Then second is the Wong-Baker facies pain scale, which reports based on the facial expression of acute pain. And there are 6 line drawn faces as well as the indication that there is at one end there is no pain and other end there was pain. And it is given a numerical value for each face also. And it is suitable for age group between 3 and 18. And next is the facies pain scale revised. Self-report face scale. The 6 cartoon faces range from, what is the revision done? Any idea for the facies pain scale which is revised? Why it was revised, Vidya?
Sir?
Why the facies pain scale was revised?
So previously it had the faces of baby, which is not ethical, and they have changed it into cartoon faces.
that the reason? Anyway, I'll show you those pictures, then you try to tell me the answer. It is
Yes.
suitable for ages 4 to 16. Then poker chip food case, which also she said, is indicative of no pain to severe pain, and it is suitable for 4 to 7. So if you see all these self-report, they are all for older children. Coming to the observational, these are the categories who cannot speak or express by words their pain severity. So there you use the body behavior, black pain scale, 5 categories: facial expression, leg movement, activity, cry, inconsolability, and each of them are given scores between 0 to 2, the total yielding 0 to 10. And it provides a simple framework that children who cannot verbalize, for them only this is used. Then procedure behavioral checklist. It is usually done during an invasive procedure. This is not for a measurement of pain after surgery. It is for measurement of pain during a procedure that is being done, like when you do central line or spinal in a child. So that sort of or arterial line. These are all the procedures that are done, and that time you can see the pain behavior. Then you can classify them. And it has 8 operationally defined behaviors with an intensity of 1 to 5, and it can be used in ages 3 to 18 years also. Then the Children's Hospital Eastern Ontario Pain Scale, CHEOPS, the measure of post-operative pain. So each one, different. Plaque is also for post-op pain and acute pain. Procedural behavior is for procedural pain. This CHEOPS is for post-op pain, and it has got 6 behaviors like cry, facial, child verbal, torso, touch, and legs, all these things. And they are given a mark of 0 to 3 based on the intensity. And this is ideal for age group of 1 to 12. Then there is a comfort scale which is used mostly in intensive care environments. So the comfort scale assesses 8 domains which are indicative of pain and distress during, including alertness, calmness, agitation, respiratory response, physical movement, etc. And it is suitable for age group 0 to 18. Then there is another scale called premature infant pain profile, which has 7 indicators, and each one is given on a 4-point scale. These include 2 categories. One is physiological response like heart rate, oxygen saturation, then behavioral dimensional like expression, eye squeeze, bow bulge, etc. So this is the visual analog scale where the child can mark the pain and you measure the distance, and this is also very useful for research purpose. BAS is used mostly for research to identify the assessment of pain post-operatively, and this is the numerical rating scale and the VAS scale. So this flat line you can draw here, whereas here you can say by the number. Supposing the child says I have number 6, that means it is more than 50% pain. And if the child says 10, that is the worst possible pain. So they can identify according to the numerical phases. And this is the Wong-Baker's phases. Here also it is only a line drawing, but there is no child face here. And this is the revised pain scale. Now, by looking at these 2 pictures, can you tell me what is the revision done here? Both are only line drawn faces. There is no actual face of a baby here. As you rightly said, original Wong Baker was a real picture of babies with various faces. But later on, they converted it into line drawings for both. Look at the picture in 10 here and the 10 here. What is the difference?
It is not crying.
There is no tear. Here there is no tear. They revised that because somebody told that if you put a picture with a tear drops rolling on the cheeks of the baby, it will frighten the children. So every child will start crying looking at this. So they revised it here. It is only a grimace that is there. There is no tear here. Okay, that is the revision that has been done here.
Yes.
And this is the poker chip, what she said. So 1 poker chip means no pain, 4 poker chips means severe pain. So they can easily say the degree. It's a rough estimate. It's not a very accurate measurement of pain. And this is the plaque scale, which you sometimes ask as a short note. So we have to know the components or expansion of plaque like face, legs, and each one is given points 0, 1, 2. So 0 means there is not much of pain. And if they get a mark of 2 for each, then that will be the worst pain. So you get a score of 0 to 10. And this is the behavioral thing which has got these several components. And this is another the intensive care method of assessing the pain. And this is the premature infant pain scale. So these are all the things that you have to remember with regard to the pain, the pediatric thing. So mainly classify it into the self-report and observational, and then try to enumerate the available scales that you can think of. Okay.
Yes, sir.